Hello, Hopkinton, and welcome to the Monday afternoon edition of the Hopkinton Hangout Hour. I'm Mike Terosian, your host, and today is Monday, December 7th, Pearl Harbor Day, that day that will live in infamy. And we remember all the men and women lost on that historic day so many years ago. So with me today in the background for the social media is Tom Nappy, and controls is Matt Clark. And today we have a special guest, one of our favorites, keeps us all healthy in town and up to date on the latest with Corona. We haven't had him on for about, I think, just before Halloween, I think it was.
Yeah.
So Shaun McAuliffe, right, Shaun?
Yeah. Well, thanks for having me.
So it's time for another update. We just got over the big hurdle. Thanksgiving's done. Christmas is coming. But we have a whole bunch of stuff, and we only have 59 minutes left. So where would you like to start? Let's get us started here. I'm just going to let you go.
We can start with the basics.
Yeah.
I don't think I don't think anybody is going to miss the fact that we're in a surge. And Hopkinton, like everybody else around us, is seeing a significant increase in the rate of illness. We are, I had posted about a week, I don't know, it's all a blur, about a week, 2 weeks ago, about how from March through September 20th, we had 140 cases. And then from September 21st to now, we have now had 156 cases. So, back in March through August, we had all of the school nurses working for us. And then now it's Casey and I managing that explosion,
Right.
The chief and Norman have been pressing me to be more positive. So
Right.
to put a positive spin on that, there's help on the way.
Right. I'm just showing everybody the community impact dashboard here to describe what you're talking about. And if you look at your active cases rolls, since it went down, you were down to 1113 from the middle of May all the way till the beginning of November.
Right.
And then and this should not be a surprise to anyone, right? This is what we were told was going to happen.
Right. And everybody knows this. We all know that cold and flu season, and we're in cold and flu season. So you throw one more respiratory disease in the mix, and you're going to see an increase in risk and an increase in the incidence. And so this wasn't a surprise. And one of the things that Casey and I, focused on, we wanted to drive down our numbers and get as much control as we could in the community so that when this time came, we were in a better position. And I'd argue to anyone that, we were successful and we're in a much better position than most communities around right now.
Sure.
So, today, and then in addition, there are all these other variables. So I know one of the things that people keep on writing Josh about, or writing Casey and I about, right before Thanksgiving, there was a shift in the way that we manage quarantines, like in the days that you're going to quarantine. So when we talk about active cases on any given day, depending on the number of new cases that have come in, it takes a lot more kind of calculation to figure out who's active. It's just more of an effort to figure out who's active and how many are not, because in the previous method, you were identified as a contact, you were out for 14 days. You had COVID. It wasn't as well defined. If you have COVID right now, you're out for 10 days, unless you're still symptomatic on day 10. The whole quarantining bit it's tougher now because you've got the 10-day protocol, you've got a 14-day protocol, and now the CDC and state are about to introduce a 7-day quarantine protocol.
Okay. So does that involve what, more tested, rapid testing? What?
It's so the 14-day. I mean the 14-day is always the preferred quarantine.
Correct.
It's the full incubation period, so that when you're exposed to that 14th day, if you haven't contracted COVID, you're not going to contract COVID. The 10-day protocol, there's this infinitesimal amount of people that if they haven't cut it by day 8, they're not going to get it. So what they did is they introduced this new method where people can get tested on day 8, and then if they're negative, they can be released on day 10. Now that represents a whole host of different issues to like a family, because you just found out that someone has been exposed to COVID in your home.
Right.
Your first instinct is to run out and get tested, because you want to bring comfort to everybody else and start figuring out, all right, get them isolated. Do I have to isolate more people in the family and whatever?
Yep.
Are they actually positive? And when you say, well, could you hold off until day 8? That causes a lot of concern. And some families who are all working remotely, it's not that big of an impact. But others, especially if there are siblings involved, they want to know right away so they can separate the siblings from the person who have the contact. So, this whole process is consuming, and we're trying to figure out ways. Actually, the nurses we're bringing on are going to, and then when we now that we're introducing this new 7-day quarantine, or the state is introducing it, it'll allow people to get out on day 7. So what this new protocol would be is they've got to remain asymptomatic. They get tested on day 5. And if on day 5 they're negative, then they can get released on day 7, but they have to self-monitor for the next week. So we've got, these 3 different quarantine strategies that we're working with. We've got, pretty much the same standard positive quarantine protocol.
Yep.
And at the end of the day, we're constantly, we're in the process now of putting together a training for the school nurses to help them with this. And so there's just a lot of work. Every time there's new regulatory change, there's a lot of work. But, at the end of the day, what the important thing is, we've got COVID all over the place. If someone has symptoms that are anyway similar to flu or the cold, you should stay home and then get tested. What we don't want, and what's happened, is you've had a family member who's been identified as symptomatic with maybe the cold or flu or allergies.
Yep.
They've sent their spouse to work, or maybe the kids to school, and they turn up positive. Now we've got to trace everybody that the spouse might have had contact with, and then we've got to put out a number of people in school. What we're asking is that people, if you have any symptoms, we want you to figure out, through your primary care physician and through testing, what it is that you have before anybody leaves the nest, because that's the way we're going to contain and prevent community spread. Because, in Hopkinton, we're one of the we're one of the few communities that, knock on wood, we have no evidence of community spread. We have no evidence of school spread. Um, and we think if we just continue to buckle down and focus on the basics, staying home when you're sick, wearing a face covering, social distancing, we're going to be able to get through the holidays
Sure.
without any negative impacts to the school. And really, that's the goal that Carol and I have laid out. It's what is it going to take to get us through the end of the year, still in this hybrid model, and then what new programs can we bring to help sustain this hybrid model through the end of the school year until we get vaccinations going. And
Right.
that
And,
brings us,
it's nice, and you're talking about that because all you hear every day in the news is this new district going remote, fully remote, and yet we still at hybrid. We did a voluntary remote for a week after Thanksgiving because you knew kids would come back from college and other people were traveling from some of the nasty states into the Commonwealth, and you opted to keep the schools closed and go remote. I know that upset a lot of people, but look at these numbers that we're dealing with compared to the other towns. We're doing so much better.
And I mean, like when I worked for the city of Boston, part of my job was I was doing the infectious disease investigation for the state and the CDC. And, I loved the holidays because all of the sick people, mostly college kids and employees that would come and commute into Boston, would go home. And then we'd break the cycle of illness. They'd typically be out for at least an incubation period. And we wouldn't have, the activity that we had prior to the holiday. Then when you look at it on the other side, now I'm inheriting all of that. I'm put in charge of caring for all that. And it's exactly as we thought. We had, I think that Monday or Tuesday before Thanksgiving, I inherited no less than 10 collegiate cases. And then that just continued to grow as we approached the holiday. And then on the backside,
is that just? Do you think that's from their living environment, like the dorms, or do you think the group houses, or was it like sports related? Was it class related? Do you know?
In college, it's just it's a collection of all of that. You've got you look at a place like UMass, you've got over 25,000 people. Like in Southwest where I live, you have over 5,000 people living on top of each other in a small quarter, what is it? It's like a 4-acre parcel, something like that. It's crazy.
Sure.
It's one of the highest densities in the United States. And it's just, you can't help but have contact with people. You're riding the elevators with them. You're walking past people in the hall. You're using the same restrooms. You just have all of these, opportunities for exposure, and it exists in all colleges. And then you factor in, most people know I was a fraternity president. You throw like a few parties in, the bar scene. They're incredible opportunities for, super spreading.
And bars near colleges? I didn't know that.
Yeah. Or so it's and it's this my experience is it's helpful in this. It's like you gotta manage these risks, and some universities have done a really good job, and then some of that issue, and so we knew that we were going to get positive college kids back. And but we had communicated to the public that if you knew or you were going to bring someone home, that they could call us. And we probably had at least 30 families reach out to us. And we helped them, manage the intake and the setup of, like quarantine rooms for their kids.
Yep.
And, as far as I know, everything worked out well. But with that said, what we've seen is a lot of residents are commuting out, coming back, and they're bringing it back from work. And a lot of it is asymptomatic. And then all it takes is, you come home, you've been exposed, then you spend a day or so going through your routine with your family, and next thing you know, it's your spouse has it, and maybe one or two of your children have it. This is the time when you want that angry, non-communicative and non-cooperative teenager, because and I have I have a lot of conversations with families, and it's my daughter or my son hide out in their room, they play video games, they don't have any contact, and I'm like, keep it that way.
Yeah, well,
that might be the one.
It used to be you got up in the morning, made your own breakfast, and if you weren't done fast up with your breakfast, your mom would get out of her room and say, "What are you still doing in the house? Get out! I don't want to see you till dinner time." And of course those days have changed with everybody with organized sports and just the busy schedules. And now, you want your kids home, stay in your room, outside the dinner under your door, something like that. Just stay there. So the families are doing their best they can. The workplaces, businesses in town, everybody's done top notch with their COVID protections. The only people that are making the money right now is these plexiglass people and PPE and sanitizers. So, but it seems like everyone's doing it, and the restaurants are still doing fine. There's still places offering takeout and curbside. Some still doing delivery, and they're all contactless, which is awesome. So people are seeing it's going to keep going, and you keep going that way. It's only been 9 months. We can handle a couple more months of this if we have to. We can handle another 6 months of this if we have to. And because once that vaccine comes out, which we'll talk about next, is the numbers, everything starts dropping, but you still have to use precaution. Just because you're vaccinated, you still have to take care of yourself and others. So vaccinations, I'm hearing a lot of talks. So what's it mean for Hopkinton?
So and like Casey and I we've been we've got our dispensing site plans put together. We've got equipment coming in that's already arrived. We've got more equipment coming in this week. I received word from one of my friends that he's getting vaccinated next week. So it's arriving. We've got about, I think, 60,000 doses are coming in for medical, for basically hospitals. That's arriving, I think, next week. Then there should be about 250,000 more doses. These, I believe, are all the Pfizer vaccines that are coming in. And then the thing to note, so if there are 60,000, my understanding, because, a lot of the detail hasn't been communicated out to us. We were supposed to get a thorough update on Friday, and then the vaccine specialist in the state got pulled out of the meeting just before it started. So we're supposed to get an update tomorrow. But so if 60,000 doses come in, the Pfizer vaccine is a 2-dose vaccine. So I think they've got enough for 30,000 doses. So it's coming. it's going to start in the hospitals. It's going to go to the most vulnerable people after that. And then we've been told to be prepared to set up our stations in April. Well, like that in the spring. We're more thinking it's going to be the later spring. But, if you look at CVS is starting to ramp up. They're looking to hire, I think, 1,000 people in this region to help them
right.
provide vaccine or vaccinations. So it's all ramping up. And once, so Pfizer is coming out first, Moderna to be a week behind. And then there's a third. They seem to be working out the logistics associated with distributing the vaccines that need to be stored at ultra low temperatures.
Right.
And we're just getting ready. That's why we've held the mobile outdoor flu vaccination clinics. So we want to just get, we want to figure out where are the bugs, what do we have to do to, improve traffic flow, and we want to make sure that we have all the equipment. We've got these mobile vaccine carts that are arriving this week, so we'll be able to set vaccine refrigerators in. We'll have portable generators to power those. Casey's working with the Medical Reserve Corps, recruiting people that can assist us in providing the vaccines. The EMTs and nurses at the fire department are all approved to assist us in this process. So I believe we'll have the manpower. We've got a couple facilities. We're actually looking to see if we can maybe utilize another location just in case we have really inclement weather. But we've got a good plan together, and it just right now I want to know when it's going to be here, and we just want to finalize this plan. We need these details to help get us there.
Right, that's awesome. And yeah, I already got my email from Lisa Jackson on looking for dates for us to be available to volunteer. So,
one thing that I was going to say, and that we also know that for a percentage, it's a lower percentage, but a percentage still, you're going to get your vaccine, and it's gonna hit you that first day because you're getting a strong immune response. So the next discussion that I'm going to have is with like public safety and DPW that we want to stagger those vaccinations so that there's a day or two between.
You don't take the whole down.
Yeah,
you don't take
yeah.
the whole down. The
Well,
town down
it's
at once.
like Casey.
Yeah.
I mean, the last thing you want is the two of us to get it and the two of us to be in that percentage. And
you
we're
go
out
Monday, she goes Tuesday. Yeah,
right. But so it's just all of this. The more that we learn, the more that we figure, that we find that we have to build into the plan. So it's it's a huge logistical endeavor, and that's really, that's why that's why we wanted the the part-time staff to come on board. That's why we went out and said we really could use the health agent to help just take care of some other stuff and but then be there for Casey and I.
Right. Yeah. So tell us, what do you have coming off part-time staff? What are you adding?
We have two nurses that we're going to start training tomorrow. They will be doing the initial contact assessment. They'll be providing case management. They'll act as a liaison to the school nurses to address questions, and then they're going to help with contact tracing, because one of the issues is that the as the number of cases in the Commonwealth have exploded, it put a huge strain on the contact tracing collaborative. So they've been training upwards to, I think, 300 to 600 staff a week to help be able to perform the contact tracing necessary. But
Sure.
that, because they were caught a little off guard, some of the contact tracing is out. Some people aren't getting calls 3-5 days out. So, but when that happens, it becomes difficult to control. So what Casey and I started focusing on was we would do all the contact tracing to the border and create, like a little insular protection where we know, as long as we were comfortable in where the illness came from, and in most cases, if not all cases, it came from outside of Hopkinton, we'd track it to the border, and then that the further investigation would get passed on to the state. And we think, because we've been able to make those calls, have those 1 to 2 touch per resident contacts, we've been able to kind of reduce our risk of spread. But I mean, I have a friend who works for the state police. They got it about a month ago, and they were bedridden for 18 days. I think they were out for a month, and they hadn't got one call from from the health department.
Wow. Hey, got a question here that came in on social media asking you about the full-time public health agent position.
Yeah. So
you're not leaving?
No.
Okay, just checking.
But then this is the thing that we keep on talking about is, like, so Casey and I, we've been spending 60 to 80 hours a week doing nothing but COVID. And one of the reasons why the health department has continued to operate is because I got a great administrative assistant, and I have a great contract health agent. But like, I need to be able to provide, we have the 495 interchange work. There are other duties that I have and responsibilities outside of COVID.
Yeah, I mean, you have, all right, let's name something. I mean, restaurant inspections, right?
There are 187 of them.
Is that all? Yeah, then we have all the cafeterias and everything. That's related to. You still have septic systems, wells. Oh my goodness!
I'm the burial agent. I oversee air quality, noise, all of those different complaints. We permit, all your food, all your camps, all your swimming pools, your wells, your septic, retail sales, farmers markets. We're in charge of environmental oversight.
Yeah.
Cigarettes. We coordinate with the tobacco inspection, tobacco compliance.
Yeah.
Vaping in the schools. We have one of the best vaping programs in the Commonwealth, and we've been funded now twice by the Metro West Health Foundation to continue that program and further develop it. And it's just like, here's all the money. This is the program we agreed to. And Dr. Zaleski has been fantastic at implementing that. And that's, you got to credit the talent that we have in the Hopkinton municipal offices, because it's these people that have been able to step up and I've been able to hand this off to. But there's still a lot that needs to get done.
Yeah, because houses are still selling. Septics need to be changed. New wells need to be dug. Not everything stopped because of COVID.
No. And it's, like I said, we've done a good job at keeping up with stuff. I don't believe we've um, we've caused any building or any development or repairs to be delayed because we've been jumping on all of that. Um, but there's just a whole bunch of other stuff that's just not. We have an allergen program, that playground allergen program, that I've got the signage, and we've got most of the materials. We just haven't been able to launch that, and just all this other stuff that's just sitting out there.
Right now, this here is not a temporary thing. This is going to be probably the growth of the department from here on out. We're not.
Right.
That's
And,
awesome. Because listen, I've been in town since '87. Um, and for the longest time, it's always been a health agent, a contractor, administrative assistant. And Casey was our first. I mean, we haven't had a nurse since Julie Harris.
right.
We used to be there. And that was, I mean, when I came in '87, she wasn't even nursing anymore, doing the nursing. She was just administration. So it's nice to see the department finally, after 30 years. It took a pandemic to do it, but it's finally grown to basically where it needs to be. And what's going to be, I think, fantastic when COVID finally takes a back step and gets out of the spotlight, I think the services in town are going to be that much better because now you don't have to neglect one thing to take care of another.
Right. And we've got a bunch of risk reduction programs that we're going to start launching, and we'll be able to provide, um, you know, we'll be able to provide vaccination services to those who, you know, or just some. We'll be able to provide extra, services to those that are homebound. We'll be able to support the senior center better. We'll be able to, if you need backup vaccinations for school, you'll be able to get them through Casey. We'll be able to provide some risk, fall, and harm reduction to the seniors, you know, to help at Golden Pond, to work down at Fairview. There's just a whole series of stuff, and some of this, we're going to try to provide services to the public. So if you are homebound, you don't have to rely on going to, getting shuttled to the emergency room. Some of the
Sure.
stuff we can do, and same with, we've helped a couple homebound seniors get COVID tested, um, you know, at their home, and like we can do a lot more, and then actually create through shifting, if we're doing a better job, we should take some of the pressure off, you know, the fire department. We should take some pressure off, our local hospitals, and then the
Right.
quality of the regional quality of life, or at least in Hopkinton, the quality of life and our health outcomes should all improve. And so it's this. We have some lofty goals here, and we have the staff that's qualified to pull it off. And right now, we just got to get through COVID.
Right.
And you
And
can
so people
help me.
get through. Yeah. So as people get through COVID, you have the. You did mention just in your last statement the Golden Pond and Fairview. How those places hold up? I mean, in the beginning of this whole thing, those were some hot places.
Right. And so the problem right now, one of the biggest problems with COVID is that we're seeing a lot of asymptomatic spread. Or I spoke to, I don't know, 6 or 7 families on Friday that the only symptom that they had experienced was like a loss of smell, and that was a gradual loss. So what we've been seeing is, in like a facility like Golden Pond, you had you know, there have been, like, there was an employee who tested positive, but we believe we caught that. And, like, Casey and I, Casey was instrumental at getting us what's called a CLIA waiver so that we could operate an antigen system. We have an antigen testing system at the health department. So we were able to deploy that. We felt our hands around any potential exposure that could have come from that individual. And then then it looks like it got introduced another way.
Right.
But, the problem in any of these facilities is once it gets in, especially if you got a decent, a fairly healthy population, which assisted living facilities, the population tends to be a lot healthier than in a nursing home. So you just like last time, you've got these individuals that are positive, but they're asymptomatic. They might be 93 and asymptomatic, or they might be infected at age 93, but they're asymptomatic. And
Right.
we saw at one point back in April, I think we had up to, not quite half of the population had tested positive, but the majority of those individuals were asymptomatic and managed the illness fine. So we've got 18 cases there now. We've since we just had our second death, and those are coming out of the wards that have the I guess the more frail kind of hospice residents. We've got but like I said, they've done a good job managing the issue. We've been on the phone with the Department of Public Health. They have had 2 meetings with the Department of Elder Services just to make sure that we've got this managed. We've been helping them, or facilitating testing in the facility. And then with that, we helped Fairview Estates. We facilitated getting that whole complex tested. So, we're out there looking at our high risk facilities and just making sure that we're doing everything in our power to get them taken care of. And again, we're at places like Golden Pond, it's making sure that, the state is bringing on at least some assistance to help them out.
I remember the start too. They brought in the National Guard to take care of the testing in all the nursing home and assisted living facilities, which was outstanding. So moving on to the next thing, I know we touched a little on the schools, but I want to talk about the sports. We just finished our first fall season of sports. You had soccer, field hockey. You had boys and girls soccer, field hockey, cross country, boys and girls cross country, and golf. Anything weird come out of that, or anything you were happy that you saw come out of that?
I had a meeting with the school administration, principals, and the athletic director this morning, and to discuss winter sports. We had one incident with one of the with one program, but it was a potential contact from another team, and we put the team out. We had everybody tested. No one was infected from that contact. So we've done good there, and we've done well there. Done good. And the athletic director, he's got a good program. He's set up you know, they the group, with the Tri Valley group, um, they meet regularly. They've done a good job at modifying the sports to reduce potential exposure. They've introduced attestation. Um, they've just done a good job at managing their risk.
Right.
And you know, they just had a meeting with all of the coaches and sports captains to discuss, you know, these are the expectations. This is these are the sacrifices we're going to have to make in order for you to, you know, to play. Um, and they're not huge sacrifices. It's just,
Right.
you know, you go there and you play. You don't hang out. You don't if you're out. You know, if you're partying or congregating or just doing things that are, you know, that introduce risk to the team, the consequence could be that the team gets, you know, put into quarantine and you don't get to play. So it's really upon all of the kids to take ownership of this responsibility, knowing that if they do a good job, they're going to get a full season.
Right.
And then we're trying to figure out, you know, how do you manage, you know, it just manage hockey is just a bit of an extra risk. And it looks like a lot of it's related to the lack of airflow on the rink surface. But they're taking protocols to help reduce that risk. And then I'd say the majority of the sports related illness that we're seeing in town is related to travel. And I mean, the traveling teams are what's killing me. I mean, I've got several out right now. And again, it's, you know, like we live in a fairly safe and kind of controlled environment here, and that's because of the effort that we all put in, you know, as a community back in the summer. But you step outside, there's community spread just about everywhere.
Oh, easy. Yeah, it's easy enough, and you see it when you're out in public. You have to wear a mask, and I can see I'm walking my dog, and I'm all by myself. Whatever, I won't have my mask on, but it's there because someone's going to have to walk by me.
Right.
You know, and you want to be able to, you know, it's only the right thing to do, and you know, there's nothing wrong. I mean, the only thing that I found wrong with wearing a mask was I did the No Shave November.
Right.
And the mustache going. I don't know how I see a lot of people with the facial hair. I don't know how they do it, but it drove me crazy for that 1 month. But it's the new norm. This is putting, and I said this back in March. This is putting our seatbelts on now in our car. You know, our kids do it automatically. I love seeing it at the schools. I love seeing it on the fields. The precautions that they took outside. I mean, here you have the athletic director sanitizing the ball every quarter in soccer. Nobody touches the ball in soccer.
Right.
No one uses their hands. And yet he's still wiping it down. Same with field hockey, everything. They weren't going to let the parents in. Then they came up with a method that the home team can have 2 people per player, and they were given lanyards. It's like, hey, here's your backstage pass card to get in. And it worked out great. Watching the fans, and you watch all our footage on HCAM, you will see the fans in the background, you know, with in between all the cones. Everyone did the right thing, and it was so nice. People stayed away, like the public. You know, even all the games were on Saturday and Sunday, the public stayed away from the fields because normally the public uses them, and normally the public could be around them, but they policed them, and they had no problem moving when it was game time. So a lot of effort there. The biggest part that I know that the Tri-Valley League is working out in Rich Cormier is going to be the indoor venues.
Right.
You know, such as basketball, which is going to be a chore. Volleyball, for instance. You know, here we are. We got to wait till fall too. That's February, and where Hopkinton's bleachers are that pull off of the wall is all seating for classrooms and
Right.
and lunch. So they're not going to be able to pull them off. And They can leave them up. No parents to those games. And you know what? I don't want the parents coming to those games for two reasons. One, they have to come all the way into the main atrium and down the stairs, boom, to there, instead of coming in just like one door
Right.
from outside in. And two, you're inside.
And
Why have the extra people there?
right, and this is all the stuff that we touched upon today, and and we credited you guys. As, you know, you know, you might not need spectators because we know that the games are going to be telecast. So
If the NFL can do it, so can
right,
HCAM, right?
and this is the stuff that we're because you know we're doing a good job here, but I as soon as you start introducing those, that extra risk from outside of Hopkinton,
Yeah.
it's a potential problem, and it's I if I had a dollar for every, well, it was only a luncheon, it was only the wedding, there were only a few people at the wedding,
Yeah.
it was only, and I'm like, but that's what got you, and so we're again we're and like I said, Rich has done a really good job, and right down to the, well, if we move this over, then we could free that bathroom up, and then these guys could use that bathroom, these guys could use, there
Yeah.
we're down to that kind of detail when we're
Yeah,
discussing it.
they get the sign in the high school, one person in the elevator at a time.
Right.
It's they're doing everything, and I think when you go ahead and introduce more to it than what's going on there now, I don't go there. I mean, I've got equipment at the school, and there's things I could do there. I stay away from there. I don't want to be
Right.
there. They don't want me there. I don't want to be there. So you stay out of the places you don't have to go.
And
I'd rather have my food delivered to me instead
right.
of going there. Why have that extra chance of me, or what's the chances of me having affecting a cash register a person, or who did I pass in the aisle because they went up the wrong way or whatever? It's just easier to limit yourself. And you know what? Yeah, I want to see my kids play sports too, but you know what? Is it worth getting someone sick over? Is it worth someone dying over? I mean, I love talking about that wedding in Maine.
Yeah.
That all the people were dying, and the people that were dying weren't even at the wedding.
Right.
And they contracted from people that were at the wedding. So, how could you live with yourself knowing you did something you should have done, and now someone's died because they got exposed from you?
Right. And this, like, you mentioning the desks in the gymnasium. Like,
Yeah.
we were discussing that. Well, if we did allow, up to say 24 residents, we could seat them at the desk spaced out that have the QR codes that they could scan. Because
Oh yeah, there you go.
one of the
Wow.
things that Rich and a lot of others, attestation and the ability to track where people are helps. And when I knew that I could go to Rich and say, hey, I need to know who's the coach who was at this game, and they'd be able to provide all of that detail, which just helps us stay one step ahead
Sure.
of the illness. And
Yeah, now
so-
in these records here, you got to help explain to people too, because no one likes tracking. God forbid.
right.
I went up to Maine while it was still safe, and I went into a Denny's for breakfast, and had to wait outside. They see you. They unlock the door. Yep, you want to come in? Okay. Be right with you. Yep. Okay, you're gonna go right over there. Then they come over, put your name and phone number on here. I mean, it's not like they're gonna sell it to the credit
Right,
companies.
right.
No, they're gonna keep it for a couple weeks and then throw the things out.
Right.
They don't want that paperwork.
Right. And
They don't
that
care
gets
who you
to
are.
this, we're, and I don't, when people ask why the schools don't have and weren't required to have attestation, I don't have an answer. I mean, it's required in every workplace sector in the Commonwealth, but the schools. And we've demonstrated that it works, throughout all the municipal offices. We've had, you know, relatively speaking, I don't know that we've had more than a handful of cases since when we first introduced attestation into the municipal offices to now. I know of two that we've recently had,
Yeah.
but it provides us a means of tracking. It's a means to educate the public, and it's just a means for people to kind of separate from what they were doing. They fill out the attestation form. They think for a moment, well, work did tell me to go get tested. Oh, that tells me I shouldn't send my kids. Like this process that we're introducing into the school will allow, people that pause and provide them that guidance or a little extra instruction. And if they don't have time, they can call Casey or I the school nurse is in a jam, but they can call Casey and I or the staff that we'll have available to ask these questions, because it's that little that pause. It takes me 5 seconds to fill out the form in the morning.
Sure.
But it's that little extra step that's going to go a long way to keep the community safer in the schools operating. And it's the thing is that this is a change. It's a change that affects a significant part of the community. And but at the end of the day, we firmly believe that this is going to be what it takes to get us, get the school through the end of the year and then out to the summer. And it was funny because I'm not part of all of the Facebook groups, but a lot of it was reported to me, and I'm like, they don't have any medical information, they don't have any insurance information, they don't have any social security numbers. They have a phone number, they have an email address. You can opt to get the stuff sent to your phone and have it so that you get a text message to alert you to do it each morning or not. You put in your children's names, and then we're not asking you to do anything beyond filling out the attestation. We don't want you to put your insurance information. You don't need to do any of this extra stuff. It's simply this, and it's what I do every morning with my kids. It's nope, you don't, nope. And my wife has to do it for work. And, the kids, if I'm running behind, my 5-year-old will grab the infrared, temperature gun. She'll shoot my head and the rest of us. And then, we fill out the paperwork and then we're gone.
I tell you, I love going to one of my favorite establishments. They have it on the wall now. And if I forget to walk by, you hear this thing come up,
Yeah.
Low temp. And it's like, oh yeah, ding, pass. It's awesome.
And the thing that really is terrible with COVID is that those that get fevers, they tend to get, it's not even a full fever. It's like 99.5 is where you're like, so it's just enough to make you aware that I'm just feeling a little off.
Something's going on, yeah.
But, if you take your temperature in the morning, you go, oh, wait, I got a 99.5. And then that causes you to just think things through. Or, if you've got, like allergy symptoms, but you're not an allergy sufferer, or
sure.
It's just that, there's a story about a case that we had in town where they got home from work, they started cleaning, and they started sneezing, and someone came home to the house and said, my God, that candle just stinks. And they went, that's funny, I can't smell the can. Oh my God. And they knew because they filled out the form every day, they just put everything down and they went off to the urgent care and they got tested. And sure enough, they were positive for COVID. But they were otherwise completely asymptomatic. It was just the fact that they knew that the loss of smell was, one of those key symptoms to be on the lookout for. And then we didn't get any other spread, and not even in that household. And it's
amazing.
Just putting this simple little, no, there's no one in my family that's got it, COVID. No one's been recommended to get testing. We haven't had any contact with any positive people, and we don't have any of these symptoms. And that just goes to this whole other thing that, again, wearing a face covering, distancing, staying home when you're sick, and just improving your hygiene. That's all we really need to stay above this.
Oh, I tell you, my hands are so dry. It feels like I'm back working construction again.
Yeah.
With all the sanitizer everywhere, and it's funny too. I'm not going to carry my own, so I use it everywhere. Use it on the walls, use it, on the tables and wherever I'm going. And it's just all the different stuff. Some have a spray, some have a thick gel, some is watery, and but they all dry out your hands.
Right.
And so and I noticed too, all the cracking and it's brutal.
Yeah, no, it's
but you got to do it.
Right, and it's you owe it to your family, the people you work with. It's
right. And I always joke around and tell people, I said, I used to wash my hands after I went to the bathroom long before COVID.
Right.
Okay, it's just it's not to do it.
And then what we're seeing is that just the rate of illness in general throughout the town. Like if we're doing this, then the rate of flu, the rate of we're actually doing our medical professionals a favor by keeping that other illness out of the system so that they can focus on COVID. Because as tired and just like, if anybody's done with COVID, it's Casey and I.
Yeah, I'll definitely say that. That's for sure.
And the only other people, it's the people that are doing the testing at Hopkinton Urgent Care. It's the pediatricians that are in town taking care of the kids, and then it's the hospitals that are having to to watch over the people that are really getting ill, and it's a lot of work and it's a lot of stress, and there's a lot of sacrifice in this whole throughout the system where those of us that are providing the care, we're trying to keep our own families safe.
It's nice to know that you get some help covered. You get the part-time nurses, you have the full-time agent all coming on and increasing the size of your department, making you continue the services that we are accustomed to living within this town. And by you adding some relief for you and Casey is going to be nice to see, because, you still didn't pull out all your hair yet. You still got some left up top. And
I got a gray streak that's going right there.
Yeah. You look like Stripe from Gremlins there with the
Yeah.
So, Shaun, I want to thank you again. Definitely have you back on when we have something new, but I want to definitely schedule you for after the first of the year. Hopefully everyone stays home this New Year's Eve, and we'll see what happens at Christmas. But hey, go take a break. Go get a coffee or something, will you?
Yeah, I got to go relieve my wife.
You get the next thing. All right, Shaun, thank you. And everyone at home, we want you to tune in on Wednesday at 7 p.m. for the Hopkinton Hangout Hour, where we're going to be talking about your favorite Christmas traditions with the HCAM crew. So I'm Mike Terosian. Thank you, and have a wonderful day.
Right, thank you.